Yes.
Thank you, We're at the risk of the postprandials now. And I always learned in my faculty development fellowship says never give a talk after two different things. One after a budget meeting, and the second one is immediately after lunch, thinking about the postprandials that do sink in. But thanks for being here. We do appreciate it. This is our next session, and hopefully is as informative as and entertaining as it has been in the morning as well. And hopefully we have some very distinguished guests with us today and our panelists, and so I'm very honored to be part of that today. So the title of our particular session is known as Creating a Diverse and Inclusive Environment. And the objectives of this particular session is to hopefully highlight some of the promising solutions for fostering a diverse and inclusive and connected environment that promotes the well-being of all populations. And I think it's really apropos in the sense of now that we're filing the session that was just before lunch, I think really fits really nicely and is very much in alignment with what I think our guests are going to be talking about today. My name is Dr. David Acosta. I'm the Chief Diversity and Inclusion Officer for the Association of American Medical Colleges, and so it's a great pleasure to address you and moderate the session today as well. Today, our hope is that each of our panelists will spend about 8 to 10 minutes or so describing their promising solutions and practices that they are practicing at this time, followed with a little bit of reflection for about 10 minutes, and then opening it up to the floor to hear some of the questions from you as well. So just really briefly, what I'd like to do is introduce our panelists very quickly, and then I will go ahead and set the framework, and then we'll go ahead and listen to each of our panelists as well. So it's an honor to introduce you to our distinguished panelists. Our first, to my immediate right, is Sonia Smith. Sonia is the Senior Vice President for Access, Diversity, and Inclusion at the American Dental Education Association here in Washington, D.C. Sitting next to her is Dr. April Bigelow. Dr. April Bigelow is an adult gerontology nurse practitioner and teaches at the University of Michigan School of Nursing, where she serves as clinical associate professor. And our third panelist is Lenora Billings-Harris. Lenora is an author, an international speaker, a diversity strategist from the Ubuntu Global as well. So I'm showing you this one slide as we kind of break into the framework a little bit. It's kind of a follow-up, it seems like, from our last session from the morning as well. So in addressing health professional well-being, the institutional culture and its climate play a significant and a very critical role in shaping the lived experiences of healthcare providers. And given the rising trend of the health professional burnout, it's a time that we begin to address those lived experiences as discussed in our earlier session, including the challenges that are faced by our healthcare professionals, and especially our future health professional workforce who have historically been excluded from opportunities and also found themselves to be marginalized and lonely, as we talked about this morning. The next generation of work, I feel, should move us towards having the courage and the willingness to risk political capital to examine our institutional policies and processes, our infrastructure, the expectations and the unspoken rules that have perpetuated a double standard and in some cases a triple standard for some specific population groups within our institution. And as said by Catherine Peltier Campbell within a quote, the legacy of exclusion in higher education is becoming even more difficult to ignore, not only because of our growing diversity in our country, but also because of the heartbreaking scenes that have played out across higher education over this past year that are outside the walls of some of our institutions, sometimes within those walls as well. These challenges, again, have also been documented very well in the academic medical literature. And these are some of the challenges that are faced, and I'll give you a new acronym. I can already feel it. Oh, another acronym we got to remember. This is one that I think is a little bit more inclusive. This is HURGMBS, stands for Historically Underrepresented Groups in Medicine and Biomedical Sciences. And so even our literature also talks a lot about what came up today as well, and it was well covered in the prior session with regard to what research tells us. And as we know, racial biases, discrimination, daily microaggressions, mistreatment, isolation, and marginalization are very real in our academic medical centers as well. And they have been leading, there's lots of, they're important factors of burnout and lead to specific poor emotional and mental health outcomes, especially in our historical underrepresented groups. And the argument would be that if we're going to be effective in reducing and overcoming the prevalence of burnout, it will certainly require an intentional and a critical deconstruction of some of those structures, the policies, the practices, some of the embedded institutional traditions, norms, and values that in some cases are assumed to be race neutral. So our institutions will need to take a closer look and ask a simple question of ourselves. What exclusionary practices are operating here? What are the lived experiences of our healthcare professionals in our institution, and how and where is it that they are feeling excluded, feeling minimized, feeling diminished, feeling marginalized and isolated? As some of us have been doing this work for a long time, it certainly begins with a deeper understanding, and that deeper understanding comes from a deeper assessment of the institutional culture and climate within both our learning environmental space, but also in our workplace as well. And that's at all levels of the organization as well. After the assessment, it usually is followed up with understanding the practice of something now that is coined as called conscious inclusion, and how to intentionally move towards inclusion excellence within our workplace environment. To describe what that means, again, practice in conscious inclusion really brings up the word intentionality, that we as leaders, we as medical educators, we as caregivers, we as staff, we as students and learners, we as residents and fellows, again, intentionally move towards asking ourselves, how can we contribute to the inclusive environment that we all ascribe to and want to build in order to basically begin addressing burnout. And so if we think about inclusion excellence, these are just some descriptors of what an inclusive excellent organization that is essentially functioning and doing inclusion very well and have achieved inclusion excellence. These are some of the parameters that are becoming important. And the framework is that, number one, that differences are recognized. The differences are valued, but not only just recognized and valued, but they're also leveraged. Leverage keeping the mission in mind and how we can use the differences from all the talent that is within our health systems to basically that we can leverage that to allow us to meet our mission even more fully. The second piece of it that is very important, and this is the difficult one, and that is that authenticity and intersectionality are recognized, they're valued and embraced. We talked a lot about the multiple identities this morning, that everybody in this audience, we all have multiple identities and not just one. We're not described just by what we look like. We're not described just by our job description, but each one of us carries a multiple identity with us wherever we go. And we make that conscious decision about what we are going to allow, what identity is going to be, we're going to allow people to discover and to visualize with us. But the important part about those multiple identities, we also realize that if you're in an organization that provides a safe environment, that the intersectionality between these multiple identities is a real crucial piece, because they identify how we think, how we make decisions, how we see the world, and how we treat others as well. So an organization that is practicing inclusion excellence also values that authenticity and intersectionality to the point that they create safe environments so that people can share their voices openly and create even brave spaces with that. You can be authentic, meaning being truly who you are according to the identity is, without the fear of judgment, without the fear of retribution, without the fear of retaliation. And in those three sequences, again, it's the whole idea that you now are in an environment where everyone feels validated for who they are, valued for what they do, and respected. Because of those four entities, essentially now you have an organizational community that ultimately has a good sense of belongingness. And that is simply put that everybody who works there, doesn't matter if it's your staff, your learner, your residents, your fellow, your faculty, or your top leadership, everybody feels that they play a significant role in they're a fundamental fabric of that organization as well. Practicing conscious inclusion also requires equity mindedness. And that basically talks a lot about being intentional. The intentionality, as I had mentioned before, to identify some of those exclusionary practices in our institution, and then deconstructing those structures, those policies, those processes, those prevailing traditions and norms, so that we can get to this point of having equitable opportunities for all. And it's also an institution that invests in success, not just in our student learners, not just in our faculty, but even at the staff level, who basically also serve our learners, our residents, and our fellows and faculty as well. The investment in success with the hopes of helping professional development and career development move forward as well. And then last but not least, none of our programs and our initiatives would be successful without having an accountability system that's clear, transparent, where it holds everyone accountable for any diversity and inclusion efforts, and in some institutions that have done this very well, is part of their performance evaluation. So this is what we're trying to aspire to. Think about the world in which all of our institutions practice every one of these elements. Our hope is that this would be, again, something that would help us reduce, if not eliminate, some of the burnout. And just I'll leave you with this. This is, the AAMC has been working on developing some foundational principles for inclusion excellence to help our institutions have a set of guidelines, a set of roadmaps or guideposts, if you want to call it, to help people understand and how to get to this point of inclusion excellence. So on your very far left is essentially the 9 benchmarks that we have created with some descriptors about that. This next to it is an assessment tool, 9-question assessment tool to find out where are you in the space. And the last one is a scorecard where the results of that particular assessment are mapped out. And basically you can't see it, but they're mapped out for each one of these. And what they basically will do is ultimately it'll be demonstrable about where that particular institution may be, whether you have no demonstrated commitment or evidence of meeting these benchmarks, or moving to the next grid, which was you're on the threshold, you're aware of it, but you don't have anything in practice yet. The third one is beginning commitment, where you may understand it, you have an awareness, but not only that, but you have 1 or 2 initiatives or programs that are basically working towards those benchmarks. And then the last one, which we're all trying to move towards, is that you've accomplished inclusion excellence and have exemplar practices that you can share. So with that, without further ado, I'd like to go ahead and bring our first speaker, Sonia Smith, to go ahead and present her material to you.